Now, I'm guessing there's different reasons why you guys are here. Some people are probably just curious to know, does hypnosis exist? Is it a thing? Is it this thing you see on TV, or is it something different? Maybe some of you are curious to know whether you can sell with hypnosis.
Yes.
Yeah, whether you can.
I'd like to use it in fee negotiations.
Precisely, yeah. Can you use it in a pitch situation, for example? Can you use it for persuasion to build client relationships? Maybe you're interested to know whether you can use this stuff in the media, whether you can use it for advertising, and whether people do use it for advertising, because probably they do use some of this stuff for advertising. And can you use it for politics? Are our politicians hypnotizing us? Are they trained in some of this stuff, and do they perhaps use some of these language patterns and things in order to influence us? Or to kind of build more of a bond with us, more of a bond of rapport with us, you might call it hypnotic rapport. And I think the answer to all of those questions is kind of yes and a little bit of no. But ostensibly, it's probably more yes than no. Can you use hypnosis for sales? I'd say that all sales is an example of hypnosis. It's just maybe you use a different term for it, you understand it slightly differently. And to explain what I mean by that, really I think it's good to start with talking about what hypnosis is and where it came from. Because although the term hypnosis is fairly new, the ideas of hypnosis have been around for a very long time. In fact, they probably date back all the way to Egypt at least, ancient Egyptian civilizations. Certainly the entire history of shamanism, medicine men, they all did something that we would recognize as being similar to hypnosis today. And I think really, for as long as human beings have been thinking logically and rationally, we've probably been doing hypnosis in some way or another. Because hypnosis is really about applying that kind of linear, straight line thinking to processes which at a deeper level are more complex than that. So one thing that kind of characterized the last century was how we moved from sort of straight line thinking of physics in Newtonian terms to more of a quantum understanding of the universe, where everything's kind of happening all at the same time and things don't necessarily happen sequentially. And hypnosis is really something that has worked in the same way, always works in the same way, in that you have your essentially two minds. So you have a conscious mind, which is the one that's logical and rational and thinks in straight lines. Then you have your unconscious mind as well, which is the mind that's more quantum in its operation. It's the mind that can handle many, many different things all at the same time. And it's the one that's responsible for things like kind of beating your heart for you or regulating your immune system and so on. So obviously when it comes to using hypnosis therapeutically, it's the unconscious mind you're interested in. Because logically speaking, if you have cancer, you want to stop doing cancer. It's a logical, simple thing that you think. But in order to do that purely through suggestion, because there are plenty of hypnotists out there who work with cancer patients, and the objective of that hypnotist is to have the person go into remission. It's not simply about treating the symptoms anymore, it's more than that. It's a bigger claim that hypnosis is making now, that actually it can treat diseases like that. So it's the unconscious mind you're interested in working with. Same with smoking, for example. Logically, it doesn't make sense to smoke. It comes to a point where you think, I don't really want to smoke anymore, maybe most of my friends have stopped, or it's expensive, or I don't like the smell, or the taste, or it kills you. So why is it that we carry on doing it, even though logically we know it doesn't make sense? Well, because it's your unconscious mind that's in charge of all those processes. And that's why applying logical thinking to your unconscious mind is what brings about the change for you. Now in sales, you have the same kind of thing going on. That you can throw all of the logical, rational, reasonable arguments you like at somebody who's a potential customer or client, or people in the media as well if you're advertising through mass media. Logic and reason and rational thinking isn't what gets sales. I mean, we all know that. We all work in advertising. We all know that sales are emotional. We buy because something makes us feel right, something makes us feel good, or it avoids us feeling bad. So all hypnosis works in that same way. It's about tapping into those unconscious processes, those more emotional processes, and applying logic to that. So I want to keep this fairly open. I'd like to take your questions rather than just giving you a load of information about hypnosis for two reasons. One, it might be more interesting, and two, hypnosis is quite big. You know, I could easily sit here and talk all day about hypnosis and we wouldn't scratch the surface of it. So it makes more sense that you guys tell me what you want to know, and then I'll answer your questions. Also, when we get towards the second half, I'd like to do a hypnosis, if I can find a willing volunteer for that. So, people think we volunteer. Should have had the camera facing that way.
What characteristics are you looking for in a willing victim? I mean, a willing...
in a victim?
No, in a
legend.
Partner.
Yeah.
Legend.
It's very simple. It's just about following instructions. I think...
That's just half the field.
So the process of becoming hypnotized is very easy. It's something that every single person does every single day. If you get in your car and drive it, you're in a trance. It's exactly the same. If you ride a bike, you're in a trance. If you get on the underground with your headphones in, you're in a trance. You read a book, you're in a trance. There's millions and millions of trances that happen all day to every single person. It's just a question of creating one of those states on demand, if you like, and one which is a little bit deeper and has more interesting characteristics to it. But the process you already know how to do. In terms of what would happen when you are hypnotized, I know that there's a lot of kind of foolish portrayals of hypnosis in the media and things, and on late night TV, I think there's a program called Back in the Room or something like that, which, you know, is dubious at best as to whether A, these people are hypnotized, and B, it's, you know, it's sensible to put a program like that on when there's so many other benefits to hypnosis that it undercuts. That being said, you know, because this is an office situation, in any case I wouldn't get somebody up here and ask them to dance like a chicken or whatever it is.
Could you if you want to?
Well, the thing is that stage shows always, you'll see the hypnotist will get a load of people up on stage, probably 20 or 30 people up on stage minimum on a big show. And then they will gradually send people back. They'll give them tests to pass and then they'll send them back into the audience if they don't pass the test. Because they're looking for something specific, and it's not the person who goes into the deepest trance. It's the person who responds best to the suggestions, does exactly what they're told, and is an extrovert. Because let's face it, you don't get up on stage at a hypnosis show to be hypnotized if you're not extroverted. You know, those people who do those things on stage at the show probably do the same thing on a Friday, Saturday night in the pub anyway. So it wouldn't be a question of whether or not I could do it, it would be a question of whether or not I could find somebody who wanted to do it. And I suspect in this room probably I could find it. But that's not what we're doing today, we'll do something a little bit different. So yeah, I mean, what questions do you guys have about hypnosis?
Well, so I was hypnotised, when was it? About 15 years ago.
Yeah.
Stopped smoking. And it worked for about 2.5, 3 years. No, it's got to make sense.
All of a sudden.
So, how come that thing can last, one, so long, but then just turn off?
I don't think it's so much that it turns off. It's you have experiences which cause you to change how you feel about that particular process that happened, how you feel about your own identity. And also the thing with smoking is that it's very addictive, as you probably know. Yeah. So if you have one cigarette, then if you've been addicted in the past, immediately your mindset changes to think, well, it's so addictive, I know that because I've already been addicted to it, but I had one cigarette and that means that I'm probably addicted again. So actually the barrier for ex-smokers to get back into smoking is much lower than for people who've never smoked having their first cigarette. So if you've never had smoked and you have that first cigarette, it tastes disgusting. And maybe you go on and you smoke for other reasons, peer pressure or whatever, but it's not because you're addicted at that point. And it's certainly not because you've enjoyed it. I don't think anyone truly enjoys the first cigarette. It's extremely poisonous. But if you've already been a smoker, and suddenly you can just re-access all of that. As soon as you have that one cigarette, you can re-access all of it. The other thing I think that a lot of hypnotherapists don't do in their protocol for smoking cessation is to change how you feel about being a non-smoker. So they can switch it off. It's quite easy to switch off smoking, it's not difficult. But if you don't change what that means to the person, then the chances they'll go back to it are quite high. This is why I think Alan Carr has been very successful with his seminars. His book, if you read it, is centered on the idea that you don't ever crave cigarettes when you give up. Giving up is easy. It's only because you feel that you are deprived of the cigarette that it's difficult. And anything that you're deprived of becomes more and more and more attractive. As long as you feel you're deprived, it just gets more and more attractive. And if you've been deprived for 3 years, it becomes very attractive. You know, if you've been deprived for 20 years, it becomes extremely attractive. And then that one cigarette, when you have it, means that your chances of becoming a smoker again at that point are very, very high. So it centers around that, changing your beliefs so that you no longer think, oh, I'm stopping myself from smoking. I don't smoke because I've decided to stop smoking. To, I don't smoke because it was a disease that I had. That's the premise of Alan Carr's book. You know, smoking is a disease, and when you get over it, and when you get free of it, you should never want to go back. And that's why his seminars are very successful, I think. But also why you can do the same thing with hypnosis. You just need to make sure that one piece is in there.
And how has, take the UK mainstream medicine view changed with hypnosis? Has it changed?
Yeah, massively. For a couple of reasons. Firstly, a lot of doctors have been getting into hypnosis. The founder of what we think of as being modern hypnosis was a doctor called Milton Erickson, who he was actually paralyzed. He had polio twice in his lifetime. And the reason he got into hypnosis was twofold. One, he just wasn't physically strong enough to work on his farm, on his dad's farm, so he didn't have that option as a career path, so he thought, well, maybe I'll try medicine, because, you know, I can write and I can think and I'm quite good at it. Also, he had a great deal of pain. And this was when painkillers weren't as good as they are now. So in order to deal with the pain of, you know, having polio and the aftermath of that, especially in the latter part of the 20th century, hypnosis was his best option. So he was the kind of archetypal doctor who discovered cures for his own ailments, if you like. That was what motivated him to a large extent. So a lot of doctors have been attracted into hypnosis because of that. Also, particularly in burns units, hypnosis is used to speed up healing. So the average, you know, time in intensive care for somebody who's got third-degree burns can be slashed by anything up to sort of 60-70% through using hypnotic suggestion and visualization processes to increase the rate at which the body heals. So I think any doctor who's interested in statistics, and I think most of them are told that they have to be, would look at that and go, well, there must be something in hypnosis, even if it's just for the healing after the cause of the problem is removed. Stuff like curing cancer is a lot more, it's difficult legal ground. Like as a hypnotherapist, you'd never claim to cure anything because you can't prove it, because the word cure is basically owned by the pharmaceutical industry. But to cause cancer to go into spontaneous remission is kind of the objective of that top level of hypnotherapists. And these are the same people who probably have medical degrees and who decided, well, I'm not going to prescribe drugs because hypnosis is more effective, it's more rapid, it's cheaper, it's more ecological for the human being involved as well. So yeah, it's shifting, but there's still a lot of skepticism because doctors are still trained on that Newtonian paradigm. You know, they don't proceed with the idea of quantum physics that actually every time you observe something, you change it. You know, it's the observer effect in quantum physics. Just by observing anything at all, you're changing it. So that's a problem for medicine because, a patient comes in with a symptom, they tell you what the symptom is, as soon as the doctor looks at it, they change it. You know, but modern medicine doesn't have an explanation for that. It just sort of skirts around it at the minute, and it tries to prescribe drugs around it and does diagnostic things around it. So we're in this, I think it will be a few generations of doctors that will have to go through that system of training to be able to shake that up. so that medicine catches up with where quantum physics is right now. But it's certainly moving forward. And there are doctors like Deepak Chopra, for example. He wrote a book called Quantum Healing, which is very much about that, taking ideas from esoteric thought, specifically the Eastern school of Hinduism and things, and applying it to modern medicine.
Yeah.
So yeah, it's changes.
So do you think that hypnotherapy's got a role with every measure of medicine, not just maybe psychological conditions? I mean, we spoke at the pub before about how it's being used with cognitive behaviour therapy. The thing I was asking is like, how is it used within kind of more extreme psychological scenarios like schizophrenia, bipolar? Like how does that actually work with that? Because essentially you're working with two personalities, so how do you have one which is suggestive and one which isn't, or?
I don't think it's two personalities. The interesting thing is that you will come across psychiatrists who specialise in multiple personality. Every single person that they see suddenly has multiple personalities, because that's just the way that psychiatrist understands mental issues, if you like. Other psychiatrists specialise in bipolar. Suddenly they see bipolar everywhere. I think that these definitions are too broad, and they're defined on behaviour as well. Like every single psychological condition is defined on behaviour, not on some chemical imbalance or anything else, just the behaviour that people do. So if people do the behaviour of schizophrenia, then they're schizophrenic. They're labelled as schizophrenic for life. But they can change the behaviour and do something else. Then they would have a different diagnosis. Psychiatric medicine doesn't incorporate that. Hypnosis does. Because hypnosis is just about changing behaviour, really. It's about saying, hey, you smoke, well, do something different instead. Hey, you crave cigarettes, well, why don't you suddenly take all of that energy and put it into a different experience internally? So you can work with any psychological condition using hypnosis. The question marks would be whether or not you have a sufficient level of education in terms of the ongoing change for that person. Because you can get a very profound change for somebody sitting in your consulting room, but then they walk out into the real world and that reinstalls all of their problems. So whilst they're sitting there with you, they are, they come in there really anxious. After half an hour they're really relaxed, whatever. Then they go back out in the world and they re-experience all the triggers for that anxiety. So hypnosis tends to treat symptoms, and psychological conditions are defined based on the symptoms. So hypnosis will change that, for sure. But will it get to the underlying root cause? Most hypnosis, no. But there are types of hypnosis that work. There's ways of helping a person go back into their past and re-experience or re-evaluate events that they've had in the past. So
is that regression?
Yeah.
Right.
With schizophrenia, there is a theory that it's caused by family situations, generally, where you have a parent or both parents, perhaps, who put their child in an unwinnable position, where they don't feel that they can do anything right, or where they don't think that they can understand any of the communications that are coming in. So they stop trusting any communication that comes in. They're not capable of understanding the context in which communications are received. That stems from a decision. At some point or another, that child must have gone, this piece of information and that piece of information doesn't, they don't go together. I can't put that together, so I must be wrong about this. My context must be wrong. So they make decisions about not being able to trust the context of communication. So if you can get back to the point where they made that decision and you work on that decision, you remove that decision or you change that decision, it will have a profound and long lasting effect on that person. But it's very much more advanced than kind of smoking cessation or anxiety or whatever.
Or cancer.
Yeah, or cancer. Yeah. Well, I mean, the thing with cancer is that there are many treatments for cancer that are not medical. There's diet, there's laughter. People have laughed themselves out of cancer. It's been well documented. Just sit down and just watch funny films for 3 weeks and then, but it's true. Because laughter, it changes your biochemistry. And since cancer is a process you do, it's not a disease that you get, it's not a virus that you contract, it's just a process that you do. So you change the physical condition of your body so that you can't do that process anymore, and it disappears. That's the theory behind that particular treatment. Now, I mean, it's not something that I'm suggesting in any way. You know, if you get a diagnosis, you know, don't take my advice, seek other independent advice on it. But there are options.
I would say I have a ringing tinnitus in my ear. It's kind of been sitting there for a while. But I went to see a doctor, paid a lot of money, and one of the things he said was you should think about this as well. And I was very sceptical. I said, really? You just spent half an hour explaining to me physically what's happening in my ear. How is this going to help?
Well, there's a link between the physical world and the mental world, for sure. And whether or not it's that the mental world sits in the physical world, or just that they're linked, is, you know, it's beyond the scope of this conversation, for sure.
Yeah.
But definitely there's a link. So often with things like that, it's a question, you know, the kind of questions a therapist might ask you, and I'm not off, but the kind of questions a therapist might ask you is, you know, so what is there that you don't want to hear? What is there that you don't want to pay attention? What is there that you want to block out with this? Because it might be that the physical manifestation is just a very, very literal translation that your unconscious mind has done of a more general instruction. So with tinnitus specifically, you know, it's very, very hard to treat it physically because they know the cause of it, but they can't change that. But equally, it's a question of how you perceive that. Because this annoying ringing in your ear, take the right psychedelic drugs, it's probably quite lovely. You know? You can change the way that you experience it.
Yeah.
So, Matt, what's your backtrack a little bit? What's your story? How did you get into this? How did you learn it? And what do you practice?
Okay, so originally I was working at Barclays, and it was kind of my ambition to be a banker, of all sorts. But I achieved what I wanted to achieve in my life. I was there. I was wearing like sharp suits and making lots of money and working in a big tower in Canary Wharf, and I thought that was what I wanted. But actually, I'd never been more unhappy. So I started looking around and thinking, well, what is it that's caused this? How is it that I can achieve what I want, and yet it's made me more miserable than I've ever been in my entire life? Is it that I was focusing on the wrong thing?
You're so hypnotised.
Was it that I was focusing on the wrong thing, or was there something else to it? So I kind of started looking about for answers, and since I was, you know, a programmer at the time, I was doing a really technical job. I came across neuro-linguistic programming, and I thought, well, that's basically like, you know, unplug the keyboard from the back of the computer and plug it in here and reprogram what's going on, which is actually not such a bad explanation of what neuro-linguistic programming or NLP does. It basically allows you to take control over your internal experience, if you like. Because whilst you may think that you're living kind of in the real world somewhere, you're not. Every single one of you is living inside of your head. Everything that you perceive outside of you is actually a projection from inside of you. You know, all of the visual experience you have of this room is something that's created inside your brain. It's light traveling in through your eyes and then being transposed so that you create this. And we have a similar colour of eyes, so maybe we see things quite similarly. We have a different colour of eyes, so I assume that we see things very differently. We must perceive colours differently, surely. You know, someone with blue eyes must perceive it differently to someone with brown eyes. But we'll never know, because that's just the subjective experience we have. It's the only experience we'll ever have. So I thought, well, maybe NLP has the answer. So I went and I did a one-day course in NLP. It was a free introduction to NLP. And it was kind of interesting, so I did another 3-day course afterwards, which was a seminar that I now run, called, I call mine Unchain Your Mind. It's more or less the same seminar. I do it slightly differently, and I do it to a much smaller group of people. But it's the same process. It's like a hypnosis regression type technique. So you work on events in the past, but in a way that's actually quite fun. And you don't work on the traumatic, crappy events in the past. Why would you want to? You know, you work on the ones that are really empowering to you, the ones that really make a big difference to how excited you'll be about, you know, going out there and experiencing everything that life has to offer. And then I signed up for another training, which was cancelled, but I'd already paid for it. And they said, well, hey, you know, why don't you do an NLP? practitioner certification. I thought, well, why not? So I did that, and then there was a hypnosis component to that the last day, and the rest is history, really. It's just something that I found came very naturally to me as a programmer, and had a big impact, a very rapid impact as well. It's like I was looking for this magical cure, and I think almost because I was so ready to believe that it could be that simple, I made it that simple.
So can you hypnotize yourself?
Yeah. Everyone does.
Really?
Yeah.
Which is, how do you know? I just want to be you see me sitting by my desk like that going,
Every day, Robert.
So many things are trance. The programmers and developers in the room, for example, they're all in trance. When you see them in the zone, that's a trance. Creatives in the zone, that's a trance. Even if you're working on the business side of things and you're in the zone, it's still a trance. Because you exclude other things. And we'll probably get an example of this later on. That when you are in a trance, you can exclude even the noises of sirens going past and motorbikes and whatever, because they become less important. They can seem quite loud and quite annoying when you're trying to shout over them. But if you're inside trying to stay in a trance, then it's very easy to just exclude them and just go, oh, it's just a siren, and focus more and more of your attention internally, which is what going into trance is all about. It's no different from meditation.
you have to train yourself to get into that trance. You can't just go,
Back in the room.
Yeah, you can.
but you can when you train to be able to do that to yourself.
Well, the thing is, falling asleep is going into a trance. Sleep is not trance, it's slightly different. But I think on the way there, you've definitely got trance states. So if you can fall asleep, you can go into a trance, you can put yourself into a trance. So everyone can. It's just a question of taking that state and extending it, so that you don't go directly all the way down into sleep, but you get to explore it and do other things within that state.
So what happens to the brain itself when you're in that stage?
Pass. The brain is phenomenally complex. And one of the biggest problems that medical hypnosis and clinical hypnosis has right now is to find the definition of trance. Because it's very hard to do any kind of qualitative or quantitative studies unless you can define what this thing is. Unless you can say categorically, yes, this person was in trance and this person was not in trance, and this person did this behavior and this person did that behavior, and they're different, it's very difficult to prove anything in a way that the medical community would accept. So there's a lot of research being done on the neurological conditions of trance. It is characterized by heightened theta waves, so more theta activity in the brain. Sort of the end of alpha going into theta is where the most productive trance states are. But again, these things are so difficult to measure unless you have very accurate equipment. You can buy something that you can do with Bluetooth to your phone, which will measure your brainwaves for about £100, and it's reasonably accurate. I should have brought it actually. And you can see that when you hypnotize someone, their brainwaves will change. They will have an increase in this theta state. But beyond that, it really depends what you're doing. If you're asking somebody to vividly imagine a situation, then obviously you're going to have more activity associated with the visual processing parts of the brain. If you're asking somebody to pay attention to their internal feelings, then it will be a different part of the brain that's stimulated by that.
Is meditation a type of hypnosis, and is that a self kind of trance or something?
Yeah, I mean, it's a difficult question to answer, because if you read kind of spiritual, esoteric books, a lot of them say, well, you can get the same effect using hypnosis, but it's kind of not the same. You want to do it through meditation, because that's the way to get the longer term benefits. So hypnosis is kind of the shortcut. It's a particular set of states, meditative states if you like, that are more powerful or have more possibilities or more obvious and immediate possibilities. I think that if you meditate for 20 years, then maybe you'll have a degree of control over some of your internal processes that most hypnotists would be slightly jealous of. We see, monks in Thailand and whatever. they have that much control over their physical sensation that they can protest by setting themselves on fire, and they say, well, you know, I'm making a protest. It doesn't hurt at this stage because I've decided it won't hurt. So yes and no. As with every question today.
Can you use it for bad? Can you make people more hypnotic?
Yeah, see me later.
Now, can the army use it to make people more aggressive, or you know?
Possibly. I mean, certainly the army, they do hire some top hypnotists as consultants. However, it's illegal to hypnotize people in the American army. It's completely illegal.
Only in America.
I don't know about other countries. I know that hypnosis is illegal in Israel, completely illegal. But that was because there was a stage show where some lady was hypnotized, and then 3 weeks later she fell down the stairs or something, and then she sued this particular TV company, and she won the case, saying, well, I wasn't taken out of trance, I walked around in the trance for 3 weeks and then I fell down the stairs, something like that. And they
do people try that? Like, I've just murdered my wife, but I was hypnotised.
Yeah. It's a difficult area. That's why I tend to at least audio record my hypnosis sessions, if not video.
Yeah.
Because that way there's no question of what happened and whether or not it was safe. With the example of the lady who was in trance for 3 weeks and then fell down the stairs, that's nonsense. That's absolute nonsense. You fall asleep, you wake up, and that's it. You're out of trance regardless.
Yeah.
You know. But equally, I think that you probably do walk down the stairs in trance pretty often. It's possibly the safest way to walk downstairs, because trance is that automatic mode where you're not thinking about stuff. You know that it's when you're overthinking things that you make a mistake. So if you learn to play a musical instrument at the beginning, you're thinking about where the fingering is, and you can't play. As soon as you stop thinking about where the fingering is and you know where the notes are, then suddenly you can play that instrument.
How come when people get hypnotised and then the people that have been hypnotised can't remember their full experience? Is that a form of it, or is that something that the person doing the hypnosis is trying to get that reaction from someone?
It can be both, really. It's very useful, amnesia. Yeah, it can be very useful, because sometimes you want to protect that person from material which has come up in the past. So you can give the suggestion where the unconscious mind, you decide whether or not you want this person to be consciously aware of it. The unconscious mind might also take that decision on its own. There's probably a lot of things that you're not consciously aware of. Most of them completely innocuous. Maybe a few of them your unconscious mind has gone, well, we don't need to think about that. It's traumatic and it doesn't help, so we're just going to put it behind the screen, if you like, and just not deal with it. So yeah, the thing is, memory is perfect. Everyone remembers everything perfectly. It's a question of how you access that. How you can recover those memories and what you can do with those memories when you do recover. Certain people have, completely eidetic memories or photographic memories, and they can remember absolutely everything in remarkable detail. In hypnosis, everyone has that ability. Everybody can go back and completely re-experience any part of their life in that level of detail, even to the age of 2 years or younger. There have been examples of people being hypnotized, going back and describing in absolute detail their second birthday, including the feel of the dress that they're wearing, all the presents, what people are saying to them, which is interesting, because at 2 years old you wouldn't be able to process language.
So does it work on babies? Can you hypnotise babies?
See, that's a
Yeah. Yes, you can.
How? Sleep for 8 hours.
Well, you match the breathing.
What's that?
You match their breathing.
Match their breathing.
Yeah, breathe at the same rate as them. You will build a bond of rapport with them, and then you put yourself into a more relaxed and calm state, and they will come with you. Yeah, it works very effectively.
Is that very old memories? I mean, there's no way of validating that. You can't. If somebody says they can remember the feel of the particular dress they were wearing when they were 2, and the voices they could hear, that might be a kind of a made-up. It could be a made-up memory. There's no way of actually validating that that is actually as someone's like, wow, she really did remember that from 2 years old.
Yeah, I think that it's unusual that people create something so vivid. It's possible, I suppose, but you'd have to question why would the person do that. Now, sometimes it probably does happen, other times it doesn't happen. I'll give you a good example of a particular technique called timeline therapy, where part of it requires that you give the option for the problem to exist not just in this life, the problem that you're working on, but that actually the problem could have existed and been created in the womb, or in the past life, or passed down genealogically. And I don't know whether you believe in past lives or genealogical transmission, if you like, so that it comes down through your ancestors. But it's been found that if this technique doesn't have that option, there's certain people for whom the technique won't work. And it's not the people who believe in past lives or ancestral memories or whatever. It's more often the people who don't. Because it allows you to take that experience and put it outside of you, if you like. You can put it 15 generations back in your family history, go back and work on something which resembles that or has the same structure as your problem. So it may be created or it may be real, but equally everything is created at one level. So whether or not it's absolutely factually what happened or not would be difficult to validate. But whether or not that dress did exactly feel like that, only one person could tell you anyway. Only one person could tell you.
Parents did.
No, the parents weren't wearing the dress.
No, they might have dressed you when you were 2 and going, yes you did, look at the picture, it's like that.
Yeah.
Didn't they?
Yeah.
You could validate it.
Yeah, you could validate certain portions of it. You couldn't validate the entirety of it and the
Is there anything dangerous about hypno, or like, can you accidentally wipe someone's mind? Nothing like that.
Is there anything dangerous about it? It's very powerful. And as with anything that's powerful, as with anything that's powerful, it can be used in a way that's not helpful or useful to the individual. And it can be used deliberately in that way or accidentally in that way, for sure.
Could you so you're saying about sort of schizophrenia and stuff like that, and sort of, hypno and blah, but could you also kind of almost give someone schizophrenia?
There is a theory that that's happened.
Right, it's quite dangerous, isn't it?
Yeah, I think, to be honest, I suspect that people who become schizophrenic acquire it from the people around them. So maybe the people around them...
Could you buy a hypno though? Could you sort of, or in some kind of, sort of similar sort of state of mind, could you sort of give them some kind of like dual personality or damage?
Anything is possible, I think is the answer. Yeah, but that kind of thing, if you were to do it accidentally, you'd have to be really messing around with something very complex and powerful. But to do it deliberately, you'd have to be extraordinarily skilled.
Right.
And I think that most people who reach that level of skill probably want to use it to do something good and creative with it, rather than to do something awful and terrible.
Totally, but I'm just saying, just not knowing it, could you? It is possible to do that.
I believe that anything's possible with hypnosis,
right,
for 2 reasons. One, I've seen remarkable things with hypnosis. Also, there's a theory from a guy called Andre Weissenhofer, who's a very, very scientifically minded guy. And he's very critical of a lot of hypnosis. But this is what he says. The patient has the uncanny knack of reading the mind of the hypnotherapist and making their projections come real. So if you work with a client and you don't believe that hypnosis is effective for the treatment of smoking, you will never get a result with that client. And it's been tested out, numerous times anecdotally with people going, well, I didn't really think I'd get the result, and I didn't. It's very rare that you get a hypnotist going, well, you know what, I didn't think it would work, but my God, it worked. It just doesn't happen. It's always, well, I thought, there was a chance this would work, so we tried it, and it worked. Or I was pretty sure that would work, and it did work. But it's almost never that you'll hear a hypnotist go, well, I didn't think it would work, but it surprised me and it did. Because it just doesn't work.
And just get back to the point, you said that somebody may have been given schizophrenia. What, accidentally or?
Well, no, I mean, there are always stories. there's always stories that, you know, people use this kind of stuff in malicious ways. And you'll read it in the papers, and you know, if you go online and Google it, you'll find it. I don't really want to get into the specifics of it, but of course it's out there. You know, of course people are suggesting that hypnosis can be used for this stuff, and that this person has done that with it.
When people come to you for treatments, do they usually have a course, or is it a one-off? Does it depend what it is?
Yeah, it depends. With smoking, it's a one-off. With something like anxiety, for example, it can be a longer thing, because there's two ways to approach it. Either you aim to get the problem fixed in a single session, or you teach people different ways to respond to their environment. You know, if currently you respond by getting anxious or overwhelmed or feeling, you know, you have low esteem or whatever it is, you just teach people to do something differently in those situations. And then you don't need to get to the reason why they had that problem in the past. You can just give them something different in the future. So there's two ways.
So it's changing behaviour then?
Yeah, but it's changing not just externally manifested behaviour. It's changing behaviour that happens inside. It's changing the sequence of internal representations that happen. So instead of, you know, outside of consciousness, if you like, a particular event out there being the trigger for a particular sequence of pictures to be processed in here leading to a particular sensation, you change the pictures that are processed. So instead of putting all of your energy through these visions of, some calamity happening, you put your energy through pictures of the outcome you'd like, being successful in the job, for example. You know, I've coached people in job interviews, and very often, you know, when you start talking to people who are nervous about it, they're saying, well, do you know what, all I can think of is that I'm going to get in that room and I'm not going to be able to say what I want. So, well, you're thinking of the wrong thing. You need to rehearse what you are going to say when you get in there.
But this sounds like creative visualization and all these kind of...
It is.
You know, if you think about the negative, then that's what you bring to you. If you put up positive energy, then that's what you get back. It sounds like it's, to you, really linked. It's quite open, isn't it, then, hypnosis, and what that covers?
There is no particularly satisfactory definition of hypnosis. So, yeah, it encompasses everything from medical science all the way through to completely out there, esoteric, law of attraction stuff, and everything in between. But somewhere in the middle, I would say, is the idea that we process the world visually, predominantly, and we experience sensations physically, and that is what drives behavior, is what we see out there in the real world, how we interpret that in our heads, and what kind of feelings that generates. Because if you want to sell something to someone, you want to get them feeling good about whatever it is that you're selling. It's the only way you could ever buy it, get them to buy it, is either if they feel good about the product that you're selling, or they feel terrified about the risk of not having it. You know, apart from that, people don't buy. Logical reasons never get anyone over the hurdle unless they've already decided that they want to buy. It's just because they have that feeling, that check that goes on inside that says, yeah, this is the right decision for me. Otherwise, it's just, you know, logic. Logic doesn't, it's sort of empty. It has no content.
So what's some of the best stuff you've seen done or you've done yourself that you're kind of most proud of?
Timeline therapy is quite impressive. There's different ways of doing it, but the seminar that I do, it's a 2-day experience, and on the first day I teach people a lot of the foundations of what is NLP, but actually the foundations come from other places as well. Then the second day we do timeline therapy. And the objective of timeline therapy is to release all of the anger, sadness, fear, and hurt that you've experienced in your lifetime. All of it. Because certain people think of themselves as, well, I'm an angry person. That just means that they do a lot of anger. You know, they, if you like, they go through life kind of like this. Something happens and they get a bit angry. And something else happens and they get even more angry. Something else happens, but it's quite minor. And something big happens, and they get really angry. But because they're never draining this down, all of that is staying in their nervous system to the point where they get that the glass is full. But life's life and shit happens, so something's going to happen, and they're going to get angry. And then it overflows.
Alright, I'll clean that up.
And so it's a release valve.
Yeah, it drains this down. So they walk out and I don't have to be angry, at least for however long it takes to fill the glass back up, but they've got the technique. So as long as they continue doing it,